These are some of the before and afters that I would like you to look at. So this is a 4 week interval, one session done, and it was only one syringe done actually. And that one syringe was done and divided on both sides. Usually the protocols suggest 1 mil on one side and 1 mil on the other side. If I'm treating somebody for the very first time, do it in 2 sessions. And that's just something I like doing. So I do 1 mil in one session, call them again in a week's time, and then do another. It just gives a bit of a staggered effect of the Gowrie as well. And also the client a bit more used to the product and a bit more used to how it works. And then from there onwards, we can do 2 mils at the same time. This particular patient is one of really good colleagues and friends of mine. And if you look at the face, it was very good to begin with. But if you look at the after effect, you can see a bit of a lift of the cheeks. And if you see from the side pose, it actually gives a bit more of a lifting effect. The volumization is not something the Gowrie does, but what it does is it gives a volumization effect. And if you look at the after picture, the 4th week picture, you can see the cheek has come up a bit and giving a bit more sharper jawline. And that is exactly what we are trying to achieve with collagenesis. Now, this is a very interesting case, which was also published in the Anti-Age magazine. I combined my PDO threads, the facelift, along with Gowrie. And if you can see the whole of the face filling in, and you can appreciate the under eyes improving, appreciate the skin texture improving, appreciate the whole face, the jowls improving, and the combination effect, Gowrie. And if I want you to also look at the forehead area, and the forehead area looks really smooth and nice. And there was a ridge right in the middle of the forehead, and the ridge has improved as well because I combined Gowrie with, and that Botox on that lady lasted way longer than it would last just on its own, because Gowrie is 6 months of collagen production keeps integrity of the skin in place and removes all those fine wrinkles. And as you can see, this one, side pose, improving the whole of the effect and the effect of the jawline, giving much more younger, youthful, and fresher look. My rule of thumb is this, Diana, that I normally like to not do 2 procedures on the same day generally with any of my aesthetic treatments. But again, I have done Gowrie with Botox with patients where I have done Gowrie alone before and Botox alone before, so I know that the patient is good with both of them, and that is where it gives me the confidence to just do them on the same day. So you can do it on the same day if you are aware of the patient. For example, if somebody's having the Gowrie for the first time, I normally say just don't do anything on the same day, just give it a couple of days and then do it, just because, for example, as a rule of thumb, if somebody had to have some sort of problem with Botox, for example, or with Gowrie or anything, then you need to know which one has caused it. But if you have done those procedures separately on a client, then you know which way you want to go, and you can probably do them together. But I personally, most of my clients, I know them well, so I would do them together happily on the same day, on the same session, at the same time, and it's absolutely amazing. And this is my latest patient, which I just treated about a month and a half ago, and she's so happy. And this is not even the final result. She has had another Gowrie session after that, and we are actually looking forward to have another after. She's already extremely happy with that. So basically, if I was doing 1cc Gowrie, I would actually bring them in within a week, and I would just do another one. And then what we'll do is it will have a staggered effect of it. So basically, you kind of start the collagenesis process, and then you restart it within a week. So what it does is the body gets 2 signals instead of 1, and then it just gives a better result overall. And then I will repeat the 2 meals again after a month or so for the next specially. And then it all depends after that with the patient discretion that how they would want to be done, or the results. As you can see, within 1 month, and improved absolutely significantly. And she couldn't stop telling me how amazing she felt they were and how happy she is with all that. Similarly, there are some of the results. This is something in the past, and you can see covered for all the tendons and all the underlying blood vessels. I've started with 0.5 mil on each hand, but then I've also gone to 1 mil on each hand. So it does. that's my way of doing it. 1 ml per hand is absolutely fine. In terms of this question, yes, we can definitely use it. It's offline. It's not something that we are teaching today, but it's something that can be used for stretch marks. We can, in some of the master classes, we do tell things which are a bit away from the general concept of the product. But yes, it can be used, and it would actually give thickness and a bit more surface smoothness to the stretch marks. About half of the patients I've treated so far, like 500 patients, the earlier ones, I never used to give cetirizine, and I still had very good results, and there was no issues or whatsoever. But then I tried giving cetirizine, and what I realized is that a little bit of edema that they would have, that would actually minimize or reduce, and that actually gave a bit more confidence to the patient. So that is why I started giving cetirizine to almost all my patients. Ideally, it should be given 30 minutes before but I have even given it at the time of treatment or even just after the treatment. And in either cases, what happens is that just minimizes that of swelling effect. I only prescribe methylprednisolone to my patients if the swelling has lasted more than 48 hours, which 0.001% of my patients, or if somebody is probably going to a wedding in 3 days' time and says to me, look, I can't deal with any swelling and just want it to be gone quickly, then what I do is I normally just give them 1 day of 30 milligram prednisolone, 1 day or 2 day, and that does the trick.